Thank you for joining For Our Special Kids, where we openly and honestly discuss the magic and the mess of raising a child with special needs. We are thrilled to have you here and hope this time provides you with some wonder and wisdom. I'm your host, Jennifer Lansing. Let's get started. In the first 15 minutes or so of this episode with Kim, we definitely get into the anatomy of the craniosacral system. You'll see as we continue that conversation why the anatomy is so incredibly important to the potential benefits of craniosacral therapy. So take a deep breath if you're not incredibly sciencey, because really it's just in the beginning. Kim gives lots of examples about how a small pull on our kids' system, something she calls a strain, could be something as simple as falling down a few stairs or bumping their heads. That strain can create a pull on an area that is seemingly unrelated. And those examples are just powerful for me, and I hope they are for you. You'll also hear us talk about the benefits of craniosacral for the entire family. I hope you enjoy, and let me know what you think. Kimberly Painter is a physical therapist, a licensed massage therapist, and a diplomat certified craniosacral therapist. She's been working in healthcare for over 35 years. Kim has a degree in physical therapy from Northwestern University, and there she gained a foundational understanding of how the human body works and its amazing capacity to grow and heal. It was also there that Kim was introduced to craniosacral therapy, a gentle and effective approach to healing. Kim's emphasis is on pediatrics and women's health, initially using traditional PT, and for the last 20 years using craniosacral therapy. Kim has a master's in natural health and is working on her certification as an IBCLC lactation consultant. Kim knows that working with children and helping them be more comfortable in their bodies has tremendous benefit to them, their families, and their communities. That is a lot.
It is a lot. Well, it's been 35 years, so I've had a lot of time.
So I just love how you said, this gentle, effective healing approach, and that's your connection with craniosacral therapy. So let's start there. What is CST?
The craniosacral system is made up of the membranes that surround your brain and your spinal cord. People have heard of meningitis. Oftentimes, that's an inflammation of those membranes that surround the brain and the spinal cord. And they look like a tadpole with a really long tail. So they line the cranial bones, and then they come all the way down to your pelvis and attached to your sacrum and your coccyx, so your tailbone. So you literally are connected from head to tail. Within that membrane tadpole-shaped sac, there is cerebrospinal fluid, which is bringing nutrients in to feed the brain and spinal cord and removing the waste products. Our brains would not function well if that did not happen. Because it has such an intimate connection with the brain and the spinal cord, and it's also made of connective tissue. Those membranes are connective tissue. And we have connective tissue through our whole body. One form of that connective tissue is called fascia, and it connects everything. Connective tissue does what it says it does. It connects things. Through those two systems, both the impact on the brain and spinal cord, so our central nervous system, the autonomic nervous system that runs right there along is part of the brain, coming down on either side of the spinal cord, and this fascial system. Pretty much it impacts everything else in the body. And it's a fairly recently discovered system. And the simple truth is the reason we hadn't discovered it is because, one, we weren't looking for it, but also it goes back to the way we were doing anatomical studies. For most anatomical research on the head, they would do what they call the Calvarian cut, where, like Frankenstein, like you cut off the top of the head, right? But if you do that, you're cutting right through this membrane system, and it's destroyed before you even know it's there. So that was one reason why they never found it. And then the other reason is because our system of medicine in North America comes from the Anglo-Saxon school of medicine. Back in the 1600s, there were two schools of medicine. One was the Mediterranean Italian school. One was the Anglo-Saxon school. Anglo-Saxon school did all of their anatomy research on embalmed cadavers, which totally changes the tissues. And we all learned, I learned in PT school, the cranial bones fuse by the time you're an adult. But the Italian Mediterranean School of Medicine used fresh cadavers for their anatomy studies. They have never taught that the cranial bones fused. So you have this mass educational movement saying something that's not actually correct. And there's still people today in medical school who think that those cranial bones are fused. That system then, when it is healthy and mobile and supplying the brain with good nutrients and taking the waste products away, everything functions better. And when it's not, we start to have some challenges. So,
okay. So
in a nutshell,
yeah,
that's the craniosacral system. And as a therapy, then what you're trying to do is come in and use this very light touch to facilitate self-correction. Our bodies are amazing, and they know how to heal. If you cut yourself, fortunately, our cognitive awareness does not have to tell that how to heal.
Right.
Your body knows.
Yeah.
We know how to grow a baby. I mean, imagine if we had to do that with just our brain.
No, thanks.
We'd end up with a Picasso child.
Yes, you would.
So
yeah.
Our bodies know what to do. And so this therapy is very gentle because it is connecting in with that innate self-correcting ability and just supporting it to do what it knows how to do.
Okay. So it's a lot of science right there for everyone that is just almost on the stop. I'm going to another podcast. Let's just back it up for a second. Okay. So when you talk about systems, we're looking at everything from the respiratory system to the cardiac system to the digestive system. It's how our body works. And what you're basically saying is there's another system that we don't have to think about that runs naturally when working properly to repair and detoxify our brain and the spinal cord. So the cerebral spinal fluid runs from the brain down the spine and back up, etc. And it's a system that's just running without us knowing it. So how does this translate? Because then, so you talk science, and then you talked about this innate ability, this gentle and touch, this intuitive ability of our body to heal, right? So how do those two things work together?
So that innate healing ability is integrated into the anatomy and the physiology. And from my perspective, from whatever enlivens us, okay, whatever that energetic source is, divine source, however you want to call it, whatever keeps it, that makes it different from when you're alive and when you're dead, that energizing force, life force,
soul, life energy,
the spirit.
Exactly.
So that part of us is where the inner wisdom, and inner wisdom is the craniosacral term for that innate healing ability. So you can call it's interchangeable. Inner wisdom, Dr. Abledger, who developed craniosacral therapy as a modality originally. There's a lot of offshoots of it now, but he is the original developer of the modality. He was a physician. He called it the inner physician. I'm not a physician, so I call it my inner wisdom. All right. And so that inner wisdom, that innate healing ability is somehow embedded within us. It's in the anatomy, it's in the physiology, because those are the things that heal and correct. And so, is it something that you can measure or scientifically identify? Not so much, which, again, I know we're going to talk about this a little bit, but it can be one of the things that makes it a little bit tricky to do research on some of this, although we're getting some really great research that's coming out now because we're finally learning how to measure some of these energetic aspects of our human beingness.
Right.
Okay.
Like
So
noetic science is like huge into, I mean, noetic
exactly.
science is really the study of this.
Right. And quantum physics and all of that, So we're finally catching up to what was being observed before. But say you and I both have a sore throat and we go to the doctor and he prescribes us the same thing. But your sore throat might be coming because you have an infection of some kind. And my sore throat might be coming because I've got a muscle strain. Okay. Two totally different reasons. Our inner wisdoms would know what they need. The doctor, when you say I've got a sore throat, he's got already a pretty well set thought in his mind of what's going on and what he's going to do about it. And he's going to treat us both the same way most of the time. Yeah, so that innate healing aspect of us knows what we each need individually to correct our anatomy and our physiology and our life experience.
Right. So it's kind of like when you slow down and you just ask your body, okay, sore throat, what is this? What's going on here? Mm-hmm. And if you calm your brain and you calm your mind, not your brain, your mind, you often will get that answer. And that's really what you're saying is it's that inner wisdom. I personally am giving myself an upgrade. I'm becoming an inner physician. I don't know what that word is, a promotion. I'm a doctor now. Well, okay. So you mentioned the research stuff of it. So I thought this was fascinating because I totally believe in this, and Teal has benefited tremendously from craniosacral therapy, and we could go into all of that. But on Wikipedia, goodness gracious, it says, I'm going to read this quote, which I just love, and I'd love to get your thoughts on it. It calls craniosacral therapy a pseudoscience, and its practice has been characterized as quackery. What do you say to that?
I'd say a couple things. First of all, if you look back through our medical history, there are a lot of things that have been called quackery or pseudoscience initially that then prove to have something behind them and then start to become main primary practice. Okay. So some examples of that would be chiropractic care. And actually, full disclosure here too, I come from a very allopathic family. My dad is a trauma specialist. My mom is an RN. My uncle is a urologist. My aunt is a radiologist. I have medicine in my blood, okay? Western medicine. So I'm very well aware of some of the biases that Western medicine can have. My dad for a long time thought that chiropractic care was quackery. He said those words, okay? Now my son is a chiropractor because, and my dad has seen him, he's come full circle and realized, oh, that really can help.
Right.
Okay? So that's one example. Let's talk about acupuncture.
Acupuncture, okay? I was thinking. Mm-hmm.
Acupuncture is thousands of years old, but it comes from a different tradition. And Western medicine just blew it off for decades. And now you can't find a cancer center that does not have acupuncture available to all of its clients. Yeah. You can't find a professional sports team that does not have a chiropractor on their medical staff. That's a trend that we follow. We call something that we don't understand quackery.
I love that.
Or pseudoscience.
Right. I don't love it, actually. I don't love it. I hate it, but it's perfect response because it is true.
Well, and it happens. Yeah. But I will say that when I went to my first craniosacral therapy class, I had read Dr. Upledger's book, The Inner Physician in You. And I was thinking from my very Western training, wow, this is a little far out there. God has a sense of humor. I injured myself right before I went to my Cranial 1 class, and I felt it on myself so that I could not deny something changed during that time. But one of the things that really attracted me in that class was how based it was in the anatomy and physiology. And that is not pseudoscience. You can dissect out the intracranial membrane system and put a slight pull on it and feel the sacrum move. Fascinating and miraculous and amazing and actual structural tissues.
Right.
So there's nothing pseudo about that.
No. Okay. So I think you accomplished that. We're all on board. It is a science and I adore it. I'm totally biased, but whatever. that whole concept of the fascia and everything being connected and putting a little tug here and feeling something move here, what does that mean in general to people? Like you mentioned, a knee hurts or a shoulder hurts, or I have headaches or whatever. What does that mean in terms of real people solutions?
So I'm going to give you a quick example. When I was first finishing Cranial 1, I was practicing on anybody who would let me put my hands on. And one of my neighbors came over and he gets on my table and I go through my little 10-step protocol and he gets off the table and he started to like kneel down and squat. And then he was sitting, like kneeling on and sitting on his feet. And he's like, look what I can do. And I was like, good for you. Like,
so
I don't understand the significance here. And he's like, no, Kim, 9 months ago, I had surgery on my knee and I've been lacking 25 degrees of flexion. You didn't even touch my knee, but I have full flexion now. He could sit all the way on his heels. And so what that told me was there was a strain pattern in his fascia that was going up to his pelvis, because that's where I started working. And as a PT, I know there is tissue that goes over the hip and also the knee, you know, your quad muscles. There are muscles that cross both joints. But also as a traditional PT, I wasn't necessarily trained to look at the hip if I'm lacking knee flexion. So that's one of the things I really love about craniosacral therapy is you're looking holistically at the whole body and recognizing that through this connective tissue that surrounds every cell in our body, you can have some strain patterns. And when you release those strain patterns, everything can work better.
Yeah. Let's transition then a little bit to children and, you know, is there an optimal age to start craniosacral? Why would a parent look at craniosacral, etc.?
But we talked about birth being an intense experience. Treating a newborn helps just clear out anything that may have come, those little strain patterns that may have come through birth. But pregnancy isn't a piece of cake either, you know. And I teach our class for conception, pregnancy, and birth using craniosacral therapy for that. And we talk about how baby is swimming in mom's emotional soup. Okay, so babies are very conscious. And so they're picking up a lot of information, but they have immature systems that don't know how to interpret it correctly. So some of our belief patterns actually get laid down during pregnancy.
Yes.
Okay? But also say mom had a sports injury as an older teenager, early 20s or something, and then, 5-10 years later gets pregnant. Let's say that they had a restriction on the left side of their pelvis, maybe SI problems or whatever. All of those structures in there could be impacted by that injury, including the tissues that are going to allow for the uterus to fully be able to grow and accommodate the baby's growth. So let's say with that injury, baby wasn't able to fully grow over onto that side. That could lead to decreased growth, or a strain pattern as baby's trying to twist around to accommodate the fact that they can't move over to that left side. So those are like musculoskeletal things for both mom and baby that could really benefit from some cranial. Okay, so something as simple as that.
Right.
But even the emotional, I said they're swimming in mom's emotional soup.
Yeah.
Can I tell you one of my favorite stories?
Yes.
Okay. So I was working on a mom and she was pregnant with number 2 and she had a little girl. And I saw her the evening that she'd had an ultrasound that morning and found out that she was having a little boy. She had been positive she was having a girl. And so I'm working with her. I've got my hands over her belly. I'm connected in with the baby as well as with her. And the sense that I was getting from this baby, this little boy, was that, I'm not sure mom is happy about me being a boy. And so and everything what you said about us being facilitators, that is basic paradigm of craniosacral therapy. I wasn't interpreting for her, your baby's not happy. Can you see what's going on here?
Right.
I was like, so how do you feel about having a boy? And she's like, oh, I feel great. I just was surprised, but I'm okay with having a boy. And so I just gently suggested, can you tell him? and have an internal conversation with him, because we teach mom and baby how to communicate directly, not like mom talking at the baby from the outside, but how to really come in and connect and communicate with their baby. And she had learned how to do that. And so she started communicating with him. So I have my hands on this little boy, and all of a sudden I'm feeling waves of relief coming off of this little boy. And this feeling like, okay, I'm going to be enough. Like, I'm okay. Now,
I want to
extrapolate
cry.
that. I know I cry. I'm surprised I'm not crying. I always tear up when I tell that story. But in that moment, I knew that child's life was going to be different than it would have been if he'd been born with that subconscious pre-verbal belief that he wasn't what he was supposed to be because he thought his mom wanted a girl instead of a boy. Those moments are life-changing, you know, and I mean, mom and I both were in tears. I try to be neutral, but that one, there were tears running down my face because I could just feel the relief coming off of him. He'll never know. He will never remember that. But you look at him now and he's just like, I think he's 7 now, rambunctious, fun, happy, strong, confident boy.
Boy. Yeah.
Boy. Yes. And they've communicated with that. And he felt heard and respected and listened to and understood. Now, imagine a baby coming into the world with that belief system in place versus the one that, oh, I'm not what I'm supposed to be. Okay. And how many adults are walking around with that, fighting constantly that idea that I'm not who I'm supposed to be. Okay. So it can be life-changing.
Yeah.
Okay. So that's one way that kids can benefit.
Yeah. So let's go to let's go to a 5-year-old and talk about maybe a child that isn't walking. We're gonna go straight to Teal. A 5-year-old who's not walking. Let's just, I've got you. Let's talk.
Well, can I jump back for a second to children without special needs? Yes. So think about your own childhood. Did you ever fall out of a tree, fall off your bike, get hit by a sibling, get the flu, have something sad happen?
All of those things.
All those things happen. If we can address them at that point, then they aren't stored in the body. That restriction, that strain gets released. So the body never has to compensate around it. And that means that they're going to have more mobility, more resilience in their tissues as they grow them. So one, it's going to support healthier growth and reaching their growth potential. But it also means that as an adult, they're going to have fewer strain patterns and be less prone to injuries down the road because they have less of these compensations that our body is amazing at doing, because we're all walking around with compensation patterns from these injuries that we've acquired and accumulated through our lifetime. And so by releasing those in any child as they happen, you're just supporting them being more comfortable in their bodies. And that has both a structural impact, an emotional impact, a mental impact, and a spiritual impact.
Let's go to an example of that then. Okay, so a 7-year-old falls out of a tree. What would you do? Because you talk about how it is a gentle yet effective. So what would a typical treatment look like with you when a 7-year-old comes onto your table?
It depends on what happened as they fell out of the tree. So let's say they hit their head. That's going to look a little different than if they sprained their ankle. You're going to be looking where in the body are there restrictions or strains or injuries that need some self-correction. Let's say they hit their head. Then I would put my hands on their head and just feel for the movement, that inherent movement. We call it the craniosacral rhythm. Kind of skipped over that part when we were talking about the system itself.
We did. It has a rhythm.
It is a rhythm
yes.
that is expressed in this system. Just like your heartbeat is an expression of the rhythm of your heart beating, and you can feel it anywhere in the body. So that I'd be looking to feel, how is this rhythm able to be expressed in that child's head where they hit it? So it wouldn't be unexpected to find that, say he landed on the right side of his head. So either his parietal bone or over his ear, the temporal bone, that actually can get like pushed in a little bit and a little jammed, right? So the first thing to do would be do the suture or the place where those bones articulate. Does that need to be released a little bit? And if so, that's what you would do first. But then you also want to check that membrane system that is surrounding the brain and make sure that it is moving as well. Because if we use the bones actually as handles to get into that membrane system.
And what's a handle?
Just like a drawer pull. So like on the temporal bones, I might be using the ears as the handle to like decompress the temporal bones out away from the head and help to open that up, especially if, say, you landed on it and it got jammed inward. You're looking at both the bones and then what's happening in that membrane system. Because let's say it got pressed in and there's some inhibition of how the fluid can move through that part of the brain. On the right side, especially in the temporal lobe, that tends to be where we think about numbers. So when there's a problem with how a child can manipulate numbers, it's called dyscalculia. It's similar to dyslexia, which would be more on the left side of the left temporal lobe. But all of a sudden, you might have a child then that was doing pretty well with their simple math and their math facts, and all of a sudden they're not. Because things aren't working in there the way they're supposed to. The fluid isn't moving, the tissue's being compressed, there's tightness. They might be having headaches. They might be all of a sudden getting ear infections when they didn't have them before, because those tubes, the eustachian tube and the inner ear, can actually get compressed. And when you compress a tube that fluid is supposed to flow through, it becomes stagnant. Stagnancy in the body anywhere is typically going to lead to some infection. And so you can just free all of those tissues up, allowing better function. I say this all the time, movement is health. Now, it's possible to have too much movement, but that's much less common than having not enough movement. So basically, you'd be looking at what's not moving well and facilitate the body self-correcting and enhancing how it can move. So that's what it would look like.
Yeah. And it's not just like a Reiki, which is very energetic. It is really looking at how are we feeling the system, or the spinal fluid rhythm? How are the bones associated? Have the bones moved? Are they not moving, etc.? So it is very science-based. I was shocked when I took my first course from you of how science-based it was. It's like,
well, it's very tissue-based and structural, right?
Yeah.
So, and that's why I led a little bit with the anatomy is because it is based in our tissues. And grounded in that. That is what you are having an impact on.
Okay, so that would be a neurotypical child.
Yes.
Let's go to an atypical child.
Yes.
Which, I mean, I'm sure you have plenty of examples. If you would love to give me an example or two of how this has really impacted a child that has disabilities or special needs.
In my own experience, probably the majority of kids that I've worked with that have had special needs have been diagnosed with cerebral palsy. So we'll talk about that. I was working with one child and she could crawl. She was 10 when I started working with her. So she could crawl, she could pull up to kneeling. Cognitively, she was great. It was all structural, gross motor type limitations that she had. But she was also having some visceral challenges. And for her, digestive function was a problem. Now, think about when you get really constipated. If you're having that problem all the time, one, you're very uncomfortable, but two, it can lead to some other health issues. All right. And it makes care more challenging. Okay. So just daily care. So working on her spinal cord was so restricted in how it could move. It was impacting the spinal nerves that come out and innervate the viscera. There were restrictions in how the innervation coming to her digestive system, her stomach, her intestines, her colon, all of that wasn't working well. Freeing up the spinal nerves, it just allowed for better communication between her autonomic nervous system and her intestines. And so the first time I worked on her, literally, that's what I spent my whole time doing. I was working from about between her shoulder blades down to her sacrum, just trying to get that moving better. both the spine, but also there was tightness and stiffness in her intestines themselves. And her mom called me the next day and was like, okay, she had the biggest poop last night all on her own that she's had since she was a baby. And that doesn't necessarily sound like a big deal, but if you are that child and that child's family, it is a big deal. Pooping is important. So, and that was just with one session.
One
so that
session.
was one example. Yes.
Wow.
Had another client with cerebral palsy. He'd had a brain injury, anoxic event at 18 months of age. I started working with him when he was like in his early 20s, determined to be legally blind. Had really thick Coke bottle glasses, could look at something like if it was really close up to his face. And over the time that I worked with him, which was about 10 years, what we started seeing was he started having visual improvement. So he's couldn't see anything unless it was super close to his face. All of a sudden, he's driving down the road, going somewhere, and he's like, oh, there's McDonald's. Oh, that's the picnic or the park where we had the picnic 2 weeks ago. Oh, seeing things out the car window as he's driving by and knowing where he's at. Okay, wow. So that was a huge thing. All right. Not only just for his quality of life, like he can see and know where he's at and make connections with things that he's done. They ended up going to McDonald's more. Might not be the healthiest thing, but that was a big deal. So there can be changes like that. The other thing I wanted to say was, again, these things they're not going to cure the condition. We do not have a cure for cerebral palsy or spina bifida. There are things that you can do to help it, but you can absolutely enhance and support quality of life for the child and the family, and enhance what they can do for themselves, their sense of independence. Going from being able to not walk at all to being able to walk with a walker opens the whole world. Mm-hmm. And so when you can help that happen on a neurological level, then it is worth any improvement.
As a parent of a child with special needs, we're always worrying. We're always wondering, are we doing enough?
Right.
We're asking all those questions. Is it enough? Is it enough? Is it enough? And what am I missing? What do I know? What do I not know about? Right. And you're giving people another tool, another possibility.
There can be some very significant benefits to using craniosacral therapy with these kids. You'd sent me a question that said, is there a time when you wouldn't want to use this with a kid? And this is my bottom line answer on that. First of all, the only contraindication for craniosacral therapy is if there's a concern about changes in intracranial pressure. So that would be, say, a child with hydrocephalus that does not have a shunt put in. We want to be very careful about that, even though this is a very gentle, light touch therapy. With anybody, you would never go against that contraindication. But for families with a child with special needs, it also comes down to priorities. You said this beautifully. This is a tool. And I happen to think it's the most effective tool I've come across. But there are also times when it might not be the most effective tool for any given child at that particular time. It might be that neuromovement type work is more beneficial than cranial. Just like you said, parents of a child with special needs are always saying, am I doing enough? And you've got to have some balance. There's no way you can use all of the tools that you have available to you at the same time, both time, money, for sure, and stress. Like you and the child, if you're going to 5 therapy sessions in a week, you cannot sustain that and have any kind of quality of life. And I've seen so many parents absolutely killing themselves and feeling guilty all the while because they're not doing everything, right? So there's a time when whatever tool it is may not be the highest priority for that child at that time. And so it's absolutely appropriate to say, you know what, we're not going to do cranial for a few months. We're going to focus on this one that seems to be really helping right now. And that is great. That is more than enough. And actually, sometimes less is more.
Yeah, I've really tried to follow Teal's lead on that.
Mm-hmm.
She's very good at, she just is the master of her own universe. Truly, she has magic powers.
But you also are supporting that, Jen, because you're listening to her.
I am listening. And I do encourage as much as possible for parents to listen to the child. They will tell you. They will. It's just like how we open this up. If you slow down and you ask your body, why do I have a sore throat?
Mm-hmm.
If you listen, you can get answers. And
Right.
if I slow down and I listen to Teal, she coordinates things. I mean, she lines everything up. And I do think also that the time for integration is incredibly important, where we just take a family vacation for 10 days or 2 weeks and we don't do anything. We let her brain work and process and breathe and move the way she just wants to move.
But I think another one of, going back to what you were just saying, one of the other great benefits and the things that brings me great joy that I'm passionate about is if you can teach a child to connect in with their own inner wisdom and empower them to access their own innate healing abilities, amazing things can happen. And then they have that for the rest of their life, and they become much more confident, much healthier, because they're listening to what their body needs. They feel respected because they've been heard. Teal, I know, feels respected by you because you listen to her. Parents that don't listen to their kids are doing the best that they can.
Yeah.
But by facilitating the connection to their own inner wisdom, you are setting them up for a healthier life. And they become kinder and more compassionate because they know who they are. They can hear what they need. And so they're more of a whole self. When we are more of a whole self, we're not looking for someone else to fix us or fill us up. We can look outward. And I know this might sound a little grandiose, but I really believe that the world would be a kinder, gentler place if every child received this type of tool. And I'm not saying it has to be CranioSacral Therapy, but this idea of being able to be heard, understood, valued for who they are, lots of things would change in our world. And I think that is one of the greatest gifts that I offer to my clients and to my kids and my grandkids.
Yeah.
Because they have all gotten cranial since the time they were
in utero
fetuses. Yes, especially the granddaughters. You look at them and they're just helpful. Not that they're perfect. Believe me, they're not perfect, but they are very resilient, kind, compassionate little human beings or big human beings for the ones that have grown up.
Right.
And I think that's a gift.
Oh, a huge gift. And as you're chatting, I'm realizing there's a whole slew of caregivers and moms and dads that could utilize some craniosacral to be more connected with themselves, so then they can listen to themselves more, which then frees them up to have more listening for their child.
Exactly. We teach that to our therapists, that you're not just treating the child with the special needs, you're treating the whole family. Yeah. Because sometimes it's another family member that all the energy is going to within that system, that family system. And if you can release that restriction, everything opens up for the families. But also, one of the best gifts we can give our kids is a well-integrated parent. Okay. What parent among us has not ever reached our breaking point where we're like, I cannot do this anymore? Parenting is a 24/7 job. And you can't do anything 24/7 without filling yourself up in some way. I can tell you, I've spent hundreds of hours receiving CranioSacral Therapy because I had my own stuff to work through. And my kids were my greatest motivation to do my own work so that I didn't put my stuff onto them. That also is a huge gift. You can make a whole family system healthier with better movement between the members and parts of it. And parents should not feel guilty about taking care of themselves.
Mm-hmm. Well, this has, Like, okay, so first of all, if they don't live in Utah, which is where you are, how would they find a practitioner that is certified and high quality, et cetera? Where would they go first? And then we'll give them all of your information so they can stalk you.
Great. So the Upledger Institute, which was started by Dr. John Upledger, who developed the modality. And so if you go to www.iahp.com, that is a directory of practitioners. If you pull up somebody and they don't have a bunch of dots next to their name over on the right side, the more dots, the more training they've had. But if you have a question, if they've had pediatric training, you can always call the Institute and say, I'm looking for somebody who's had some pediatric training. I'm looking at the directory. Can you tell me which ones have?
Wonderful.
That's probably the simplest way to do that.
Nice. And how might they find you or connect with you if they have some questions?
I am here in the North Salt Lake area. My email is kim@healtheself.net.
.net. All right.
So you can always email me, put craniosacral question in the subject box so that I know that it's not just spam of some kind.
Right. Well, I heard from you on the podcast. Woo woo.
There you go. Say the podcast. I will answer your
for
email
our special
as soon as
kids.
I can.
For our special kids in the subject line.
Exactly.
Perfect.
Yes.
Okay.
So that's
great.
The best way.
Thank you so very much for your time. The amount of passion that you have for this therapy is, it's palpable. You can feel it. And I love the balance of the science and the intuition and the knowing and the confidence and all of those things that you've just beautifully merged together into a gorgeous practice. And you're just a huge gift and a shining light to so many families. And I know that personally. But thank you. Thank you very much.
Thanks for letting me have a chance to share it, because I truly am passionate about this.
I know you are.
We help our kids. We help the world.
We help the kids. We help the world. Oh, yep. Love that. Let's end on that. Okay.
Thanks, Jen.
Thank you so much for joining us today. I hope you found one or two meaningful nuggets of information to make your day better. If you think there's value in what we do, please take a moment to tell another friend, family member, or a caregiver. We'd love to hear from you at forourspecialkids@gmail.com. You can send in a question, a comment, a topic that you'd like to learn more about, or if you'd like us to highlight a certain person, please send that information to us. It makes our show so much better and so much more valuable for you. Our Facebook and Instagram handle is For Our Special Kids. And finally, remember to witness the wonder and the wisdom within yourself and others. Until next time.